Chapter 71, Big Eggs, 2.5 years of practice. You are listening at novelfull.audio. The boy closed one eye in pain, raised one leg and said, "It's pressed, it hurts," that the nurse was holding a blood test sheet in her hand, with a healthy blush on her face. Her curiosity was piqued, small body, big energy. But after seeing the faces of high school boys, she lost interest. "Dr. Xu, the blood routine is out. Take a look." The little nurse turned to Xu Qiu. "Dr. Xu from the emergency department is so eye-catching." Xu Qiu took it and glanced at it. HB, hemoglobin, 75G/L, low, normal male is greater than 120, PLT, platelets, 34*10*9. Low, the normal value is 100/300*10*9, WBC, white blood cells, are 120*10*9. Very high, the normal value is between 410*10*9. At this time, the resident doctor who almost gave him aspirin also came over and said, "Dr. Xu, the list of chest pain patients is also out. I'll bring it to you for a look." Xu Qiu also took it. The attending doctor stretched his neck and took a look, then glanced at the boy on the bed, and said with some surprise, "Hey, why are the white blood cells so high?" White blood cells can phagocytose antibodies produced by foreign bodies, heal body damage and resist bacterial invasion. In short, it is a guardian of health. People with low white blood cells are more susceptible to infections. At present, the white blood cells of boys are far beyond the normal value, reaching 20 to 30 times that of ordinary people. Seeing that the attending doctor was interested, Xu Qiu said, "The patient has anemia, bleeding, chest pain, and severe infection. Do you know what tests should be done next?" The attending doctor's mind was racing rapidly. After a while, he confidently gave an answer and said, "Do a plain scan of the chest and abdomen to see if there is any malignant tumor." Xu Qiu shook his head. This attending doctor is still not sensitive enough. However, it's not his fault. Doctors in each department do not know much about diseases in other departments. Xu Qiu walked to the boy's bedside and said, "Take off your pants." The boy looked at the nurse hesitantly. The nurse wasn't interested either, so she turned around, pulled up the screen, and stepped outside. The boy then took off his pants neatly. The attending doctor's eyes widened. "What now?" Xu Qiu asked. The attending doctor stared and guessed, "Hydrocele." No, it won't have such serious systemic symptoms." "Epididymitis? Hernia?" "It doesn't look like it either. The patient only had unilateral testicular enlargement." "Tumor?" Xu Qiu couldn't stand it anymore and said calmly, "Leukemia." The attending doctor was suddenly startled, slapped his thigh and said, "Yes, acute leukemia. No wonder there are so many white blood cells." Those were not white blood cells at all, but the blood routine mistook leukemia cells for white blood cells, thus causing the patient's white blood cell stasis. However, how can there be unilateral testicular enlargement? This symptom usually appears during the remission period of chemotherapy. Routine blood tests mainly analyze changes in the number and morphological distribution of blood cells in the blood. Leukemia cells are very similar to white blood cells. A blood test cannot tell the difference between the two. The white blood cells of normal people range from 4 to 10 units. The white blood cells of boys are 120 units. In fact, they are leukemia cells. At this time, the boy on the hospital bed was already frightened. To ordinary people, the word leukemia is synonymous with an incurable disease. Xu Qiu took back the examination list for the chest pain patient and walked to the emergency room. At the same time, she told him, "Communicate with the family members and do a bone marrow biopsy. I will come back after handling the patients over there." The attending doctor stood up straight and said, "Okay." He glanced at the little nurse outside the screen and was about to ask her to help. As a result, the little nurse immediately turned around and ran away after Xu Qiu. "Damn it, if I didn't have to take care of the patients, I would follow Dr. Xu." The attending doctor muttered. On the way to the emergency room, Xu Qiu read through the checklist. Electrocardiogram. The ST segment is arched and elevated in multiple leads. This is typical of pericardial effusion, but it's the second checklist that's crushing. 5 values of cardiac enzymes. LDH, 520 IU/L, AST, ALT, CK, CKMB, etc. all increase to varying degrees. Troponin is also high, and this is the characteristic of myocardial infarction. Cardiac enzymes and troponin are usually found in cardiac muscle cells. When a myocardial infarction occurs, the patient's myocardial cells will be destroyed, and myocardial enzymes will flow into the blood, causing these values to change. Xu Qiu frowned. EKG supports pericardial effusion. Another myocardial infarction occurred biochemically. The key is that the treatments for the two are completely different. Pericardial effusion is better. As long as it is not complicated by pericardial hemorrhage and effusion, it can be stabilized temporarily. If it is a heart attack, that if the diagnosis is not made quickly and the blood vessels are not opened in time, the patient will soon suffer from cardiogenic shock. When Xu Qiu rushed to the rescue room while thinking, she found that Deputy Chief He was already inside. Xu Qiu, are you responsible for this patient? He put his hands behind his back and smiled. He was the one who specially hired Xu Qiu. Because of this, the hospital rewarded him and lowered the conditions for him to be promoted to a senior position. Originally, he was promoted to deputy director not long ago, and it would take at least 3 or 4 years to become a senior professor. In addition, there is still a thesis stuck. Now, he only needs to practice for 2.5 years. He smiled and said, if I had known it was you, I wouldn't have come all the way here. You can definitely handle it. However, since he was here, he also looked at the case, frowned immediately, and asked, Xu Qiu, what do you think? Xu Qiu, contradictory. He it is contradictory. Well said. You can see the problem at a glance. That everyone in the emergency room was very upset. Damn it. You can also brag about something that anyone with a discerning eye can see. Don't be a licker. At this time, Xu Qiu remembered that the patient had undergone radiofrequency ablation, so he said. It may also be related to surgical damage. He nodded. Yes, radiofrequency ablation for atrial fibrillation has a lot of energy, and it is normal to damage the surrounding myocardial tissue. It may even penetrate the pericardium. Xu Qiu flipped through the medical records left by the patient's family. Hypertension, smoking for more than 20 years, he frowned and said, it could also be coronary heart disease or acute myocardial infarction. He touched his chin and agreed, indeed. Carbon monoxide and nicotine in cigarettes can directly damage the vascular endothelium. It is the most direct cause of coronary heart disease and myocardial infarction. Xu Qiu was silent for a moment. What exactly is this deputy director here for? Can you provide some substantive advice? He seemed to realize that this would undermine the dignity of the deputy director, so he coughed twice and said, let's do a coronary angiography. After completely excluding coronary heart disease and myocardial infarction, it will be clear whether it is pericarditis or pericardial effusion. Everyone was a little embarrassed. Coronary angiography is a minimally invasive examination and must follow the surgical process. Punch and enter the heart, inject contrast agent through a specific cardiac catheter, and then observe the coronary artery. After signing the informed consent form, making an appointment for the operating room, and completing the coronary angiography. If the patient really has a myocardial infarction, it may be a bit too late, but now it seems that there is no better way. At this moment, the man on the bed suddenly cried out again. It hurts. His voice was hoarse, like a beast dragging its body. Everyone in the emergency room was startled, but Xu Qiu raised his head. He thought of a faster and more effective way than coronary angiography. Chapter 72. Your desire for control led you to send your son away. You are listening at novelfull.audio. Xu Qiu said, let's arrange a coronary angiogram first, and also prescribe some ibuprofen. Ibuprofen? He was a little surprised. While other doctors were explaining the condition to the family members and asking for consent forms, he was a little surprised and said, you are so anxious to stop the pain. It's not just pain relief. Oh. What else said? You mean, inflammatory pain. He is also a deputy director after all. In just 2 sentences, he immediately understood Xu Qiu's intention. Use ibuprofen for pain relief. More importantly, it is very effective for inflammatory pain. Myocardial infarction is an organic disease, and its pathogenesis is coronary vasospasm, pericarditis, pericardial effusion, etc. are pain caused by inflammatory edema and infiltration. Ibuprofen has a significant analgesic effect on the latter. Sure enough, soon after taking the ibuprofen, the patient moaned less frequently. The pain did ease a lot. However, myocardial infarction must be completely ruled out in the emergency department. As a doctor, you must not be imprisoned by your fixed mindset. Many diseases do not necessarily behave according to the textbooks. Wrong answers to the test paper will result in penalty points. The price of a patient's wrong diagnosis is life. Fortunately, family members and patients were very cooperative and signed informed consent forms. Coronary artery examination can only rule out myocardial infarction. If it is pericardial effusion, pericardiocentesis is necessary. You may have to wait a few hours for the senior surgeon in our department to perform the operation, said the doctor who came for the extracardiac interventional examination. Pericardiocentesis is a difficult operation, although it is only a second-level surgery. Clinically, most doctors do not want to and do not dare to touch it. The family members were a little anxious. Isn't it said that the condition is urgent? Why do we have to wait for several hours? When she was about to have an attack, Xu Qiu happened to come in. He said calmly, "It's okay. Leave the imaging and puncture to me." The extracardiac interventional doctor stretched his neck with doubts on his face. "Shall I go?" Outside the operating room, the family members were extremely nervous. The interventional cardiologist didn't go in after all, but he didn't go back to the department directly either. Instead, he fished for a while at the door. To avoid suspicion, he deliberately stood against the wall and fell asleep in this position. 15 minutes later, he woke up on time, turned around and returned to the department. There is a lot of work outside the heart. He rests here, and his colleagues have to work more. Fishing for 15 minutes was the limit of his conscience, but his family members held him back. "Doctor, how long will this operation take?" The interventional cardiologist looked at his watch. "What's the rush? It's only been 10 minutes, and there's at least half an hour left." The family member suddenly trembled and asked in a trembling voice, "What if we come out early? That means Dr. Su's skills are good. What if you come out now? Maybe the operation failed." "Don't hold me back, our director is not so quick." The extracardiac doctor wanted to break free, but the hands of the family members are like iron pliers. He was a little angry, but when he turned around, he found his family members staring at the door of the operating room. Following the gaze of the family members, a handsome man was taking off his mask and hurriedly walking out. "Su, Dr. Su." Dr. Xinwei was shocked. When the family members saw Xu Qiu's hurried footsteps and thought of the doctor's words, their legs went weak and they knelt on the ground and cried loudly. Xu Qiu came over and wondered, "The operation was successful, why are you crying?" The family members were interrupted, with red eyes. "Huh. Huh," the nurse on the side explained. The coronary angiography confirmed that there was no coronary artery disease and ruled out myocardial infarction. Then Dr. Su found that the patient's pericardial effusion was very large, so he quickly performed a pericardiocentesis. The operation was successful and the patient was out of the hospital. "It's dangerous." Another young nurse patted her plump chest and said, "Yeah, I didn't expect the amount of fluid to be so large. If we wait a few more hours, the heart will be compressed and unable to pump blood, and it will be over by then." Fortunately, Dr. Su can do pericardiocentesis. The cardiologist stood there, looking at a loss. 10-15 minutes. Have coronary angiography and pericardiocentesis been done together? He glanced at Xu Qiu in horror, then rushed around the corner of the corridor and disappeared in the blink of an eye. "The emergency department is scary, I want to go back to the cardiac surgery kindergarten." Xu Qiu asked the nurse to explain the postoperative precautions to the family members. While she rushed to the observation room, there was certainly a reason why he was in such a hurry. System Daily Task Interface. Normal difficulty, develop a plan for a high-difficulty chemotherapy session. A high school boy with a single egg is a God-given experience, baby. When we came to the observation room again, the atmosphere here was completely different. The mother who was emotionally unstable before was now squatting on the ground in silence. My father stood in front of the hospital bed and sighed. When the attending doctor saw Xu Qiu coming back, he rushed over and said in a low voice, "Dr. Su, the bone marrow is abnormal, the 3 lines are reduced, the blast cells are 37%, and the blast cells in the bone marrow are actively proliferating. The diagnosis is acute lymphoblastic leukemia. Really? Xu Qiu's guess was not wrong. At this time, the squatting mother stood up. She stared and said with some despair, "Is it really leukemia?" Xu Qiu was very strict. The current examination supports the diagnosis of leukemia. Will it affect his college entrance examination? Hearing this, the 2 policemen and the attending doctor all held their breath. It's already here. Are you still thinking about the college entrance examination? Xu Qiu didn't have much expression. He glanced at the mother and hesitated. I don't know if telling the truth will break her down, Xu Qiu said implicitly. Now it is not a question of whether to take the college entrance examination or not. He must undergo bilateral irradiation therapy plus DVP chemotherapy as soon as possible. The mother was very paranoid, with red eyes and a scary hoarse voice, and said, "You want to irradiate that part of him? Then how will he give birth to a baby in the future? Only one side is swollen, can you irradiate only one side?" Xu Qiu shook his head. Bilateral irradiation is the principle of radiotherapy for testicular leukemia. Just like when one side of an apple is rotten, mycotoxins such as E. coli have spread throughout the apple, it doesn't mean that if one breast is bitten, you can eat the other one. Then how will he have children in the future? The mother roared, rushed to the hospital bed, and asked the boy, "Why are you disobedient in telling you to play less games?" I said there is too much radiation. The attending doctor next to me was furious. Leukemia has stages of development. It first affects hematopoiesis in the marrow. The symptoms are anemia, bleeding, infection, etc. Later, it will infiltrate outside the marrow, such as lymphadenopathy, hepatosplenomegaly, DIC, oral skin lesions, etc. Testicular leukemia is one of the extramedullary relapses. However, it usually occurs during the remission period of chemotherapy. However, this mother always believed that the child's discomfort was just too pretentious. He dragged his son to this stage by force. The attending doctor sighed. This is giving away his own child with his own hands. At this time, the silent father moved his throat and asked, "Doctor, tell the truth, how long can my son live?" Hearing this, the mother's eyes showed panic. She looked at her husband ferociously, and her next words shocked everyone present. Chapter 73 Spider Sense. A disease that cannot be hidden. You are listening at novelfull.audio. Why don't you make more money, otherwise your son can go abroad to find a surrogate mother? The policeman stood at the door, looking confused. We are still here, can you speak more restrainedly? Mother seemed to realize that it was too late to say this now, so he turned to look at Xu Qiu and begged, "Doctor, can you delay it for 1.5 years until he has a baby before undergoing chemotherapy? He can't be infertile." Xu Qiu was still lucky to see the other person, so she glanced at the boy's father. The latter nodded and said, "Doctor, it's okay, just tell me, we are almost 40, we can bear it." Xu Qiu then said, "He only has 3 or 4 months left to live. Stay with him well." The implication, it would be a bit ridiculous to also consider the college entrance examination and childbirth, the mother said hysterically. How is that possible? What's the use of chemotherapy? Can't you live for several years with chemotherapy? Xu Qiu shook his head. Regardless of the different survival times after chemotherapy for different cancers, even testicular leukemia, although many literatures write that the 5-year survival rate is more than 10%, but in reality, when it reaches this stage, patients often only live 3 or 4 months. It's like a pulmonary embolism. Textbooks and clinical practice are 2 different things. Pulmonary embolism, textbooks say there is a 40 to 50% survival rate. However, the fact is that more than 90% of patients with clinical pulmonary embolism cannot be saved. The same goes for testicular leukemia. We must take the special case of someone who has lived for 20 years and cannot even be explained by medicine. That is a hooliganism, Xu Qiu explained calmly. The significance of radiotherapy and chemotherapy is to improve the patient's quality of life so that he can reduce pain and leave with dignity in his final moments. This is also the reason why patients with advanced cancer insist on radiotherapy and chemotherapy. most cancers can be removed surgically in their early stages. Once infiltration occurs, the chance of surgery is lost. It's like a bottle of ink in a basin. Early stage cancer is equivalent to taking out the ink bottle directly. Soaking is equivalent to the bottle being unscrewed and the ink soaking into the entire basin. At this time, surgery was of no use. Chemotherapy can only be given to slow down the penetration of ink, that is, slowing down the spread of cancer and living more like a human at the end of life. However, her mother didn't believe it. She pointed at Xu Qiu and said, "You are only a doctor in the emergency department and a resident doctor. I want to go to the hematology department and I want them to come and see you." Xu Qiu didn't stop him. It's one thing to want to do a job, but the choice of patients and family members is even more important. So, the mother struggled again and put her son on the transfer bed and sent him to the hematology department. Xu Qiu returned to the office calmly. A few hours later, there was a call from the oncology department. "Dr. Su, I just admitted a patient here, who was transferred from the hematology department. The first doctor I saw was you, the patient with testicular leukemia, do you remember?" Xu Qiu, "Yeah. This patient's chemoradiotherapy is a bit difficult, can you do it?" Xu Qiu smiled lightly and said, "Okay. Then I'll turn it back to you." "Okay." After hanging up the phone, Xu Qiu put down the pen. On the paper was the patient's radiotherapy and chemotherapy plan. He had expected this. The boy's leukemia progressed too late and the infiltration range was very wide, making radiotherapy and chemotherapy very difficult. Xu Qiu had previously shown her skills in the oncology department. After all, he has master-level experience in radiotherapy and chemotherapy. In the entire oncology department, there are only a few people who can treat it. Therefore, he guessed that it would turn back. Soon after, the family of 3 returned to the emergency department. Only this time, my mother looked confused, as if she had aged 20 years overnight. Xu Qiu discussed the radiotherapy and chemotherapy plan with her parents. After signing various consent forms, the patient started bilateral testicular irradiation treatment on the same day. He was looking at medical records in the office when he received the task reward. Ding! Congratulations, obtained primary chemoradiotherapy sensitivity *1. Xu Qiu was a little confused when she saw the reward. After he understood the function of this thing, he was quite surprised. This thing is usually useless. However, when he encounters patients who need to use radiotherapy and chemotherapy, he will have higher sensitivity. To use an analogy, for example, Shen Baokai. He has multiple myeloma. This malignant blood disease is difficult to diagnose and treat. When Xu Qiu dealt with it, he went through several rounds of examinations before he was finally diagnosed. After obtaining primary chemoradiotherapy sensitivity *2, Xu Qiu will be even more sensitive when she encounters such patients with indications for radiotherapy and chemotherapy. It's a bit like spider sense. This is early detection, early diagnosis and treatment. Xu Qiu smiled, very satisfied with this reward. However, you still need to be strong in order to strike iron. After Xu Qiu had dinner, he stayed up all night in the operating room while there was still 1 day left for the advanced energy potion. In the emergency department, a new record was also added. The record holder for continuous working hours, Xu Qiu, 60 hours, that when the doctors and nurses saw that Xu Qiu was still in high spirits, they suddenly felt that it was understandable that he was so awesome. Holy shit, I can work for 3 days in a row without falling asleep. No wonder Dr. Su is so frustrated. Dr. Su, are your eyes dry? Nima, Dr. Su left the operating room and entered the ward. He saved so many people in 3 days. Do you want to ask him if his eyes are dry? In the emergency department, everyone's attitude towards Xu Qiu gradually changed. From the previous envy, gradually became convinced. After all, ability is the result, and the hard work behind it is what really touches people. In the operating room, after staying up all night, Xu Qiu's expression was still calm. At this time, the system tasks were also refreshed. Daily tasks have been updated. Simple task, complete an appendectomy operation. General task, rescue 3 critically ill patients. Difficult task, get the heartfelt thanks of the patients. This distribution is reasonable. The difficulty of heartfelt thanks is no less than rescuing 3 critically ill patients. Xu Qiu just glanced and didn't pay attention, put down the equipment. go to the department to brush your teeth and wash your face, and prepare for a new day of work. At 8 o'clock, Director Wang Ping's early rounds. Almost everyone was waiting early. After all, the director only has one teaching round every 2 or 3 weeks. This is a good opportunity to learn clinical knowledge and master a lot of word-of-mouth experience. Xu Qiu was also mixed in. Chen Xiao squeezed through the crowd and squeezed to the side of Xu Qiu, whispering, "Teacher, teacher." Xu Qiu nodded calmly. Chen Xiao was pushed by the person behind her and bumped into Xu Qiu. She smiled and pretended to be fierce to the person behind her. "Don't push." Seeing that the people behind her really stopped pushing, she pouted again, looking dissatisfied. "If you don't move forward, how can you listen to Director Wang's teachings?" Chen Xiao said confidently. "That makes sense." The people behind began to rush forward again. "Quiet, get ready for the ward rounds." Wang Ping's powerful voice sounded. At this time, a resident doctor was pushed and shouted to the back, "Don't push." Wang Ping's face sank, pointed at the resident doctor, and said, "Come out, recite the medical records of the first 5 patients in a while. If you can't recite them, the amount of medical records today will be doubled." The resident doctor was immediately like a bereaved mother. In the crowd, Xu Qiu's arm was a little hot because of Chen Xiao. He wanted to shake off his hand, but Chen Xiao held him tighter. Xu Qiu frowned. This girl took advantage of the opportunity to take advantage of him. Is that right? So he subconsciously said, "Don't push." Chen Xiao blushed and quickly let go. The people around him looked at Xu Qiu with sympathy. "Dr. Xu, just now a resident doctor got into trouble because of his words. How dare you offend Director Wang?" Sure enough, everyone saw that Director Wang's face was getting gloomier and gloomier. Everyone lowered their heads quickly. Finally, Wang Ping's anger reached its peak. He scolded everyone. "What are you talking about?" Dr. Xu said, "Don't push. Get out of the way." Resident doctor. Everyone. The teaching round started soon. The medical records were not so easy to memorize. The unlucky resident doctor naturally received the double medical record package. Around 9 o'clock, the teaching rounds were about to end. Wang Ping also arrived in front of the last 2 wards. This is also a VIP ward, where Shen Baokai, the old lady, and Shen Ning's mother live. Shen's mother hates this mother and son, but in order to prevent the old lady from harming Shen Ning, she had to set up a bed here. "You come." Wang Ping glanced at Xu Qiu. Shen Baokai is Xu Qiu's patient. "Okay." Xu Qiu was very calm and naturally took over the baton of teaching rounds. Wang Ping's face was full of undisguised admiration. He was not afraid of the stage in front of so many people. This psychological quality is worthy of being a student taught by himself. Although as a future teacher, his role is to shout 666 next to him. But others shout 666, and his voice is as loud as his director. Dong dong. When Wang Ping was proud, Xu Qiu had already pushed the door in. He put his mind back and prepared to check Xu Qiu. However, the next moment, the doctors exclaimed and were frightened by the scene in the ward. Chapter 74. Have you been possessed by a medical expert? You are listening at novelfull.audio. The other 2 beds were fine. The old lady's bedside room had a red chanting machine, and the whole room was filled with religious music of unknown meaning. The old lady with a rickety figure was leaning on the bed and reciting sutras attentively. The most ridiculous thing is that there is a policeman standing next to him who looks upright but seems helpless. Suddenly, the old lady opened her eyes, pointed at a wall and said, "There are so many bodhisattvas." Xu Qiu and others looked along her fingers. Even the police were alerted, but there were only a few cabinets in the direction the old lady pointed, and otherwise there was an empty wall. Everyone suddenly felt a little scared. "Hey, is this bodhisattva coming to welcome people?" Wang Fan, the attending doctor, joked among the crowd. "I've been in the hospital for a long time and haven't seen anything." There were people preaching on the spot, setting up magic formations, and even a black bear spirit who insisted that the hospital quilt was a cassock, so he put it on himself and ran away. However, this scene is still very novel for interns and residents. Especially there is an electronic incense candle placed in the middle of the ward, which has a weird and technological feel. Xu Qiu led the doctors into the ward one after another. The young policeman felt relieved after seeing so many living people. During this period, the old lady became more and more excited. After a while, he pointed at the person and said, "The Bodhisattva is behind you." After a while, he danced and said, "The Bodhisattva has got into your belly and is going to give birth to a boy." Many female interns were shocked, only Chen Qiao listened, her eyes flickered, and after looking at Xu Qiu, she asked, "Then who is the father of my baby?" Forehead. The old lady's fingers froze, and her expression became stiff. She obviously didn't expect anyone to answer the question and didn't react for a while. When the police saw this, they understood most of it and urged, okay, don't pretend to be crazy. You are already in your 70s, so don't get in trouble with your granddaughter. He sighed, the old lady is 78. After turning 75, the legal status is similar to that of under 14 years old. Things at home are inherently difficult to manage. What's more, there is an old man who is very old and has an incredibly strong body. Bad children and evil old people have always been dark corners that the law cannot illuminate. The policeman was also helpless. He opened the curtains and let the sunlight shine into the ward. He turned off the noisy chanting of Buddha's name again and muttered, "These days, chanting of Buddha's name is very high-tech." Now that the police are done, it's the doctor's turn. In the VIP ward, Shen's mother and the old lady who rolled down the stairs woke up. However, their condition is just broken. There is no suspense about their condition, and it is not worth discussing. The focus is naturally on Shen Baokai. Xu Qiu glanced at the crowd and found that Chen Qiao was looking at him with burning eyes. "Chen Qiao, come out." Seeing this scene, Wang Ping smiled. Xu Qiu is now a resident doctor, so he doesn't have the airs of a director. They actually ask people to question the cases. Moreover, this posture and demeanor are all in style, and there is no violation at all. Is this a medical big shot taking over? While Wang Ping was muttering, Chen Qiao also walked out through the crowd. She put away her usual spooky personality, had a serious expression, and recited the patient's hospitalization history fluently. The double-case resident lowered his head. Damn it, an intern can recite it so well, and he doesn't even mutter, he can finish it in one breath. As expected of a student taught by Dr. Su. The other interns also admired Chen Qiao a little. A few minutes later, a detailed physical examination revealed that the patient had multiple masses in the clavicle of the neck, under the ribs, waist, and both lower limbs. Myeloma infiltration was considered. Hematopoietic stem cell transplantation/bone marrow transplantation is currently recommended. After finishing the last paragraph, Chen Qiao looked at Xu Qiu expectantly. There was no fluctuation in Xu Qiu's expression. He nodded and said, "Yes." Chen Qiao pouted, but she felt relieved when she thought that her teacher had always been so cold-faced and kind-hearted. It's better to be cold. Be cold to everyone. It's hard to get close to other women. She comforted herself. Next, Xu Qiu briefly summarized the situation of the sunken treasure. He imparted his experience and said, "For patients like Shen Baokai, we must first determine whether the patient has the possibility of alcohol poisoning or drug poisoning. Just smell the former." Looking at the pupils of the latter, many drug poisoning patients have pinpoint pupils. Cerebral hemorrhage and myocardial infarction must be ruled out as soon as possible. If multiple systems are involved, systemic lupus erythematosus and malignant hematological diseases should be considered. Everyone gained a lot. After leaving the ward, Xu Qiu asked Chen Qiao another question. In the treatment of multiple myeloma, what is the difference between bone marrow transplantation and hematopoietic stem cells? In the ward, considering that the old lady was always thinking about her frozen bone marrow, he didn't ask any questions. Chen Qiao saw Xu Qiu's thoughts and couldn't help but feel happy, saying in her heart, "The teacher is really cold-faced and kind-hearted." She took a step forward and said clearly and logically, "Each has its own advantages and disadvantages. Bone marrow transplant is collected directly from the donor. It is easier to survive and hematopoietic recovery is faster, but rejection also occurs faster. For hematopoietic stem cells, a cell separation machine is used to collect hematopoietic stem cells from the donor. It does not have mesenchymal stem cells and other blood components, so the patient's recovery speed and rejection are slower. The former is I want it all. In the latter, only the most important hematopoietic stem cells are extracted. Clinically, hematopoietic stem cell transplantation is more common, but if there is no shortage of money and donors, more people will choose bone marrow transplantation. Teacher, how did I say it? This time, Chen Xiao learned wisely and took the initiative to ask for praise. Xu Qiu nodded, absolutely. Wang Ping laughed, clapped his hands and said, the teaching rounds are over, let's all disperse. Go and do whatever you need to do. Only then did everyone disperse. You can still hear their discussions from a distance. Dr. Su is really amazing. He can do it with ease. Yeah, I think it's even better than what Director Wang said. I, a scumbag, understood it right away. Chen Xiao is great, beautiful, and willing to work hard to memorize medical records. I admire him. Wang Ping silently wrote down the scumbag, and sneered, it's okay, just copy a few more medical records and you won't be a scumbag. He looked at Xu Qiu's leaving figure and felt a little emotional. This feeling of being unable to suppress the other party is getting stronger and stronger. Maybe Linhai No. 1 hospital is really just a small pawn to Xu Qiu. After the morning round, Xu Qiu returned to clinic number 7 and continued to sit in the clinic. In public hospitals, busyness is the norm, and the journey from the ward to the consulting room is considered a rest. In the eyes of ordinary people, deputy directors and directors seem to only have 1 or 2 morning outpatient clinics a week. However, in fact, the doctor's schedule is already fully booked. There are lectures, surgeries, department meetings, hospital-wide consultations, academic conferences at the municipal, provincial and even national levels, etc., as well as irregular calls for help from lower-level doctors, night shifts of at least 10 days a month, etc. Xu Qiu is still just a young resident doctor, and he doesn't have many meetings to attend. However, other troubles abound. Teacher, the next patient is here. At this time, a voice drew Xu Qiu's attention back, very nice and full of energy. Xu Qiu looked up and saw Chen Xiao standing at the door very handsomely. This girl opened the door and took a look at the patient who was about to see the doctor. She was immediately shocked. Chapter 75 Don't Die in the Teacher's Clinic. You are listening at novelfull.audio. Xu Qiu also cast a glance. The person who came in was a woman in her 20s, her eyes were swollen, her eyes were distracted, her dark circles were heavy, and her spirit seemed very weak. Her right cheek was bulging, and her skin was also quite dark. What's your name? Xu Qiu lowered his head to record. The woman covered her cheek and spoke unclearly, saying, Huang Hui. How old are you? 28. Where do you feel uncomfortable? After the routine consultation, Xu Qiu raised his head, glanced at Huang Hui again, and asked, Are you married? Huang Hui was a little surprised. She had seen this disease several times at the community dental clinic, but this was the first time she was asked this question. Not yet. Where's your boyfriend? We broke up. Xu Qiu raised his head and asked a few more questions. Are you taking any medicine? How's your appetite? How are your bowel movements? Has your head been hit? Huang Hui answered everything in detail, but she was getting more and more panicked. She had checked before coming to the hospital, and it said that the brain would compress the nerves and cause toothache, which is a fatal disease. However, in the end, Xu Qiu only muttered no caries and ordered a few tests. They were standard intraoral films, i.e. dental films, electrocardiogram, and so on. Huang Hui was terrified and asked, Doctor, should I order another brain CT scan? Xu Qiu frowned. Why do you order this? Huang Hui didn't say her concerns in the end. Huang Hui was very fast, and she finished all the tests except the electrocardiogram in an hour. She had done electrocardiograms many times, but this time it was a male doctor, and she was very conflicted. For this test, she had to take off her clothes. Moreover, she was a flat-chested girl, so much so that once when she was doing an electrocardiogram, the female doctor didn't find her spot and asked, Why are you lying down? Turn over. She was so embarrassed that she almost dug out a 3-bedroom apartment. Why do I have to do an electrocardiogram for tooth extraction? Huang Hui was going crazy. She checked it out. Only then did I know that the heart is easily stimulated during tooth extraction, resulting in insufficient blood supply. In the last century, there was no need to do an electrocardiogram for tooth extraction. Many patients with underlying heart diseases suffered from arrhythmias and died on the operating table. After that, the medical industry gradually standardized the standards and made electrocardiogram one of the necessary examinations. Alas, life is still important. After Huang Hui struggled for more than 10 minutes, she finally completed the electrocardiogram. Diagnosis tips: sinus tachycardia, mild ST segment depression. Minor problem: the former is that the heartbeat is too fast, which may be related to Huang Hui's fear that she would be mistaken for the front and back. The latter is a manifestation of insufficient myocardial blood supply, but Huang Hui's case is obviously a physiological ST segment depression, so there is no need to worry about it. When Xu Qiu came back with the test results, he was dealing with other patients. Huang Hui was waiting nearby. Her face was swollen, her hair was loose, and she looked like she had lost her soul, as if she would faint in the next moment. Qin Xiao noticed this, and after sending a patient away, she quickly helped Huang Hui to sit down, thinking to herself, "Don't die in the teacher's clinic." In the clinic, Xu Qiu quietly read the examination report and wrote the diagnosis on the medical record. Periodontal apical periodontitis: first reduce inflammation, then do root canal surgery and it will be fine. Huang Hui thought of the many questions Xu Qiu asked at that time, and the more she thought about it, the more panicked she became. She finally couldn't hold it back, and tears fell down, saying, "Doctor, you really don't want to do a brain CT scan? I'm afraid there's something wrong with my brain." Xu Qiu looked at Huang Hui in surprise. "Why are you still crying?" He guessed that Huang Hui should have checked the information, so he said, "It's not brain compression, don't worry." But you asked so many questions at that time. You also asked me if I was married, whether I had children, and whether I was going to die." Xu Qiu was silent for a moment, seeing that the other party was so scared that he couldn't breathe. Xu Qiu said calmly, "You are in this state. I thought you were abused, so I asked a few more questions." Huang Hui's crying stopped abruptly. She wiped her eyes, and after her vision became clear, Huang Hui suddenly felt that Xu Qiu was glowing. "Is there really a handsome and caring doctor?" She choked and said word by word, "Actually, I have been swollen for 3 or 4 days, and I am in so much pain that I can't sleep well every day, so my condition is so bad." Xu Qiu rationally admitted, "You look stupid, and you don't look like you have been beaten." Huang Hui was unhappy at the time and blurted out, "What if you were beaten stupid?" The clinic suddenly became quiet. Huang Hui came back to her senses and found that Xu Qiu and Qin Xiao were staring at her quietly. She blushed and said, "I just said it casually." Xu Qiu didn't care and said, "Let's go to the dentistry department." At this time, Huang Hui suddenly became determined and said, I don't want to go there, I want you to do the operation." Xu Qiu was about to refuse, but he found that the difficult task, the patient's sincere gratitude, was glowing slightly. Xu Qiu reacted, and his concern for Huang Hui's whether she was abused seemed to have touched the condition of sincere gratitude. After another operation, it is estimated that the task can be completed. Thinking of this, Xu Qiu accepted the task and said, "Okay, Qin Xiao, go and help me communicate with them." "Leave it to me." Qin Xiao clenched his fist and said. Huang Hui looked at Xu Qiu gratefully, "I just feel that this doctor is warm and considerate. Doctor, my lower abdomen suddenly feels very hot. Please touch it and see if there is something wrong again." Huang Hui said, rubbing her belly after Qin Xiao left. "Xu Qiu, maybe the bodhisattva slipped in." Huang Hui didn't understand, but when the next patient came, she couldn't tease Xu Qiu anymore, so she quickly gave up her position. Qin Xiao works very quickly here. With Xu Qiu's name, the procedures in the emergency department were easily passed, but it doesn't work that well in the dental department. The doctor who contacted him said unceremoniously, "What? If a resident in the emergency department comes for root canal treatment, then the patient's mouth will be removed?" No, not even what the patient asked for. "Our department doesn't agree." Qin Xiao hung up the phone and sighed. She was about to go find Xu Qiu, but she suddenly thought that the teacher was so busy that she couldn't even handle such a small matter. After scolding himself a few times, Qin Xiao touched his snow-white chin and rolled his eyes. If he were a teacher, what would he do? Chapter 76. Am I not even worthy of being a tool now? You are listening at novelfull.audio. Qin Xiao soon had the answer. Her eyes lit up. she took out the hospital's phone book and dialed Wang Ping's number. Director Wang, I am teacher Xu Qiu's intern. Wang Ping was surprised, he had an impression of Chen Xiao. He was beautiful and could memorize medical records fluently, and he still hung out with Xu Qiu. What's the matter? He took a sip of tea and said nothing nonsense. Chen Xiao said politely, Director Wang, teacher Xu said he wants to go to the dental department for a root canal treatment. Puff. Wang Ping took a sip of tea, coughed several times, and then said half-jokingly, I used to be treated as a tool, but now I have a tool call me. Chen Xiao quickly said, No, teacher Xu wanted to find you in person, but there were several patients at that time. Okay, I don't know him yet. This kid has never come to find me in person. Wang Ping smiled, cursed a few times, and then said, I'll call them over there, and you just need to prepare for the surgery. Chen Xiao said happily, Okay, thank you, Director Wang. Shortly after hanging up the phone, the dentist I contacted called back. He no longer had the impatience he had before, and instead whispered softly, Classmate Chen, let's check the patient's medical records, okay? Chen Xiao thought to herself, teacher's name is really useful. She did not embarrass the other party and discussed the arrangements for the operating room with the doctor. There are 5 steps in root canal treatment, that is, pulp opening, pulp extraction, root canal cleaning, root canal preparation and filling. Think of your tooth as a chili pepper. This surgery is, remove the pepper handles, clean out the seeds, cores and other messy things inside the peppers. Shape the peppers and trim the edges and corners. Finally, stuff the meat inside. Then fry in hot oil until tiger skin is fried on the surface of the pepper and the aroma is overflowing. Teacher, the patient and family members are here, stop being dazed. Chen Xiao stretched out her jade-white finger and waved it in front of Xu Qiu. She looked at Xu Qiu suspiciously. I always feel like the teacher swallowed his saliva. Are you hungry? Clang. At this time, Huang Hui came in with her best friend. This is not a big or small operation, so it is best to have someone accompany you. After the two of them sat down, Xu Qiu told the other party the precautions, complications, risks, etc. of the surgery. In addition, the methods of root canal treatment are also different, and there are also differences in the choice of instruments. On the equipment, there are stainless steel instruments for hand use, such as smooth pulp needles, pulp extraction needles, reamers, and root canal files. There are also hand-operated nickel-titanium root canal files. For machine use, there are GG drills and P-type drills. Machine-use nickel-titanium instruments, etc. However, H files and K files are most commonly used clinically. This is a stainless steel material with poor flexibility, which places high demands on the surgeon. Precise feel, fine control of rotation range and pulling force. Lack of any one of them can easily damage the root canal shape. If it is a little crooked, it will cause distortion. Nickel alloy materials for machines are a superior alternative to stainless steel for hand use and are more promising. However, after analyzing its treatment effect using image quantification software, it was found that there was no statistically significant difference between it and hand-use stainless steel for the remaining filling after retreatment. In short, for the average doctor, choose the expensive machine-grade nickel alloy. A skilled artist can use stainless steel by hand as well as nickel alloy by machine. The multi-day sign-in reward allowed Xu Qiu to master surgeries including root canal treatment and minimally invasive tooth repair. It's not a big problem to get this one. Additionally, he holds a master degree in circumcision. With his skills, he can even carve a Pikachu. It's a pity that there are basically no patients who want to be circumcised in the emergency department. Otherwise, at least a few Xiaoji would be born in the world. Have you considered it? Xu Qiu asked in the conference room. Huang Hui couldn't understand these professional terms at all. She looked at Xu Qiu with trusting eyes and said, Doctor, what do you think I should do? I will listen to you. Xu Qiu gave a suggestion, H-file root canal treatment plus minimally invasive tooth restoration. Huang Hui's eyes lit up and she said with admiration, Doctor, can you still do minimally invasive repair? If the teeth are worn, deformed, cracked or decayed, I will take care of them together. Huang Hui nodded crazily, yeah, that's it. The best friend looked at Xu Qiu, still suspicious in her heart. is such a handsome young doctor really not the secret younger brother of the female director? Throughout the afternoon, Huang Hui was doing various preoperative examinations, basic blood routine, etc. Other examinations included probing, percussion, plus or minus, loosening, and no swelling or fistulas were found in the buccal-alveolar mucosa. There is also targeted cone beam CT. This thing is to further understand the shape of the teeth and the location of the disease, confirm the adjacent anatomical relationship, and thus delineate the scope of the surgery. After all, posterior teeth are adjacent to important anatomical structures such as the maxillary sinus, mental foramen, and mandibular neural canal. Moreover, in 18% of patients, the mental foramen is located above the apical foramen. In this special case, at least 2 mm of bone must be ensured in the vertical distance of the surgical path to safely perform apical surgery with a fenestration diameter of 4 mm. These experiences and rules are based on many human lives. At 5 o'clock in the afternoon, Xu Qiu rushed to the dental department. The doctor who was in contact at that time, Dr. Huang, was the attending physician and also participated in the operation as a representative, in the operating room. What a coincidence, my last name is also Huang. Huang Hui laughed foolishly. Dr. Huang ignored her and turned to look at Xu Qiu. First impression, he is so handsome. Second impression, his profile is so handsome. Let's start the operation. Xu Qiu ignored Dr. Huang. Routine disinfection, 4% articaine hydrochloride adrenaline injection, 1.8 milliliters, local infiltration anesthesia, open an angle flap, the depth just reaches the bone surface, while avoiding the lip frenulum. The periosteal stripper separates the mucoperiosteal sheet, the flap is turned to expose the damaged alveolar bone plate in the apical area. Xu Qiu's speed is getting faster and faster, and his touch is getting better and better. Dr. Huang's expression, from the initial puzzlement, gradually becomes solemn, until he becomes excited. Wow, this is great. Ken #stainless steel K file can be used like this. The 3 root canals of the mesiocheir, distocheir and palatine roots were cleared at once, without any residue. The apex positioning is so accurate, that lying on the bed, Huang Hui opened her mouth wide, and there was a sizzling sound in her mouth. At this moment, her eyes were suddenly filled with fear. Chapter 77. The young couple was frightened and cried on the spot. You are listening at novelfull.audio. She was wondering if Dr. Huang was sick. Before the surgery, he looked indifferent, but now he is so excited that he and his wife have given birth to 7 children, all of whom are wearing clothes of different colors. Huang Hui tried her best to keep her eyes open. From her perspective, Dr. Huang's eyes were shining strangely, like a perverted murderer. She quickly rolled her eyes, and when her eyes fell back on Xu Qiu's face, her heart became gentle again. So handsome. Maybe these are the butcher and the prince. Half an hour later, the root canal treatment came to an end. Dr. Huang was amazed. It's amazing. Normally this operation takes an hour. Dr. Xu is so fast. Xu Qiu said while operating. After scraping the bone surface, cover it with a layer of biogide membrane. Biogide membrane is a double-layer structure. Its dense layer blocks the growth of non-osteoblasts into the bone graft area while allowing fibroblasts to attach along the collagen fibers. On the other layer, the porous network-like arrangement of collagen fibers facilitates the integration of osteoblasts into the three-dimensional framework structure, thereby supporting bone regeneration. To understand it simply, it can be compared to a grape trellis. The weeds won't come up, grapevines, on the other hand, can climb and grow smoothly. This is also a commonly used treatment measure when bone defects are large. After completing the covering, Xu Qiu sutured it with 6 to 0 surgical sutures, stitch after stitch. Every time a needle falls, Dr. Huang's heart trembles. He was too greedy. Why does an emergency doctor have better oral suturing skills than he does? Each department is proficient in exclusive sutures. In orthopedics, titanium screws are often used for fixation, and commonly used are Kessler suture, Bonnell buried suture, etc. In the Department of Dentistry, the methods of tension reduction and in situ suturing of wounds are mostly used. It focuses on the integrity of healing, and less attention is paid to aspects such as scarring. In otolaryngology, the opposite is true. The wound is in a conspicuous place, so patients are particularly concerned about traceless. Needless to say, neurology and hand surgery are top departments in suturing, but emergency physicians are often not optimistic about suturing. Even the urology department has to sew the foreskin, but what about the emergency department? The first priority is to save your life. Even if there is a bleeding hole on the body, the emergency doctor is busy rescuing it. The wound is quickly pierced and pulled. If there is no bleeding, it is the gold standard. Therefore, emergency doctors do not have a particularly representative suture, only one word, fast. Whether it's good or not is another matter. It's almost over. But at this moment, Dr. Huang was completely shocked by Xu Qiu's fast and accurate hands. He can see. Xu Qiu did not have much experience in oral suturing before. However, Xu Qiu has strong basic suturing skills, so much so that even if he dabbled in oral suturing, which he was not familiar with, he was still very good at it, surpassing Dr. Huang by more than half. Prepare for minimally invasive repair. Xu Qiu's voice sounded again. Dr. Huang finally recovered from his intoxication, and he reluctantly said, "Ah, is it over?" Xu Qiu nodded. Before Dr. Huang could speak, he began to perform minimally invasive dental repairs. Before the operation, he assessed the thickness of the dental tissue in Huang Hui's neck and the amount of remaining dental tissue in advance, and clarified the repair plan. If you do it now, it will be very fast. The surgery uses Vita-Enamic, a CAD/CAM composite material. This is a new material that has emerged in recent years. Compared with traditional resin inlays and ceramic inlays, Vita-Enamic is easy to cut, has an elastic modulus similar to composite resin, and has the strength and wear resistance of ceramic materials. It can be regarded as an upstart in dental restoration today. Another 10 minutes passed, the repair was completed, and the operation entered the final stage. Xu Qiu is methodical. First, rinse the root canal with 17% EDTA for 30 seconds, then, rinse with physiological saline for 40 seconds, then rinse with 3% sodium hypochlorite for 30 seconds. Finally, ultrasonic cleaning was performed. After completing this series of operations, Xu Qiu used sterile paper to twist and dry the root canal, and finally sealed it with calcium hydroxide paste. The operation is over. Xu Qiu said calmly, "This is something only the surgeon is qualified to say." Dr. Huang withdrew his gaze from Huang Hui's mouth and looked at Xu Qiu blankly. Xu Qiu walked out and said, "The face is bandaged to prevent edema after the operation. Anti-inflammatory drugs are given appropriately, and the patient's sutures will be removed after 2 or 3 days. There are some other matters that you should be familiar with, right?" Dr. Huang trotted over, nodding his head and saying, I know. He originally wanted to say that we are professionals. However, when he looked up and saw Xu Qiu's calm expression, he suddenly lost his confidence. Shortly after returning to the emergency department, Xu Qiu received the news that the mission was completed as expected. "Congratulations on completing a difficult task. A heartfelt thank you from the patient. You gain primary affinity. Primary affinity, people are more willing to get close to you and touch you. And they tend to open up to you faster." Xu Qiu understood. Affinity is easy to understand. Some people look ferocious, like devils and muscular men. This kind of person, even if he becomes a doctor, will still be regarded as a butcher, and the patient will be so frightened that he even revealed the secret of spying on his neighbor's sister taking a bath when he was 8 years old. And doctors who have affinity, just a few short exchanges can make the other party trust you and ask about the condition more easily. It's not that Xu Qiu has never encountered difficult patients. They are often hostile to doctors and like to refute them with information searched on Baidu. However, after gaining affinity, it should be easier to deal with such patients again. Xu Qiu is studying the rewards given by the system. In the emergency department, everyone's heart suddenly jumped. I just felt a breeze blowing from Xu Qiu, and in an instant, everyone's mood of being overwhelmed by medical records was relieved a little, just like a window suddenly opened in a stuffy house, and everyone felt refreshed. Hiss. Wang Fan took a deep breath and felt the smell of 84 disinfectant in the hospital. The beautiful female Dr. Chen Jia, the beautiful female Dr. Yun Mei, the ordinary female Dr. 1234, all looked at Xu Qiu at the same time. That serious expression, the golden hair reflected by the sunlight outside the window. It's simply the face of the male protagonist in a medical TV series. Everyone was worried. Dr. Su seems to be more handsome. After this day, the effect of the advanced energy potion ended. Xu Qiu also went home for a long time and slept. The next day, the sign-in reward was delivered. You have completed the sign-in at Linhai First Hospital. Your impact factor is 6.0, and the reward has been greatly increased, and the reward is generous * 6.0. Congratulations on obtaining Master-level pancreatitis debridement and drainage. Ding! Since you already have a master-level cleaning technique, the master-level pancreatitis debridement and drainage technique is automatically upgraded to the perfect-level pancreatitis debridement and drainage technique. Xu Qiu was a little surprised. This system also has fusion. After the sign-in reward was collected, the daily tasks were also refreshed. Simple task, suture 10 patients. General task, suture 50 patients. Difficult task, suture 50. Xu Qiu's expression was slightly solemn. Today is a suture day. After reading the task, Xu Qiu went to the outpatient clinic. The first person to come in was a college student with a pale face and slow reaction. He was accompanied by his girlfriend. His girlfriend looked radiant. After the consultation, Xu Qiu said something that made the young couple cry on the spot. Chapter 78. That day, I was reborn under Xu Qiu. You are listening at novelfull.audio. Xu Qiu said calmly, if you want to eat something delicious, just eat more. Swish. The girlfriend stood up on the spot, helped her sick boyfriend sit down, wiped her tears and said, Doctor, how long can he live? Woohoo, how can he die just like that? The boyfriend sat there in a daze, his cheekbones were raised due to hunger, and he said in a trembling voice, I haven't had time to buy a house for my baby, and I haven't gone to the beach to watch the sunrise. I don't allow you to die. If you die, I will die too. Baby, when I die, you put my ashes in the dice, and when you miss me in the future, just roll the dice. Xu Qiu was silent for a while. He silently typed the 4 words malnutrition on the computer. The outpatient volume in the morning was large and full. In a few hours, Xu Qiu treated 3 or 4 patients who were half a step into the gates of hell but didn't know it. Around 8:30, it was a 27-year-old young man, programmer, complained of headache for 3 days, had been a whore for 10 years, had fever and nausea before, but no forehead, no history of trauma, and no history of surgery. Xu Qiu also suspected sexually transmitted diseases, but he was more inclined to neurological diseases in the end. However, there were no obvious positive signs in the neurological examination. However, Xu Qiu still asked this young man who had been whoring for 10 years to do a CT scan. Upon examination, it was indeed a subdural hematoma, and the midline had been obviously shifted. Xu Qiu transferred the man to the neurosurgery department, and prepared for surgery after hospitalization. Around 10 o'clock, it was a 51-year-old man with left limb paralysis. When he was sent here, he was still dizzy, and he fainted during the consultation. He had a CT scan at a lower-level hospital, and no abnormalities were found. Other hospitals diagnosed ischemic cerebrovascular disease and gave mannitol to improve cerebral microcirculation. The effect was minimal. Xu Qiu checked his blood sugar, and at a glance, the blood sugar was only 1.8 millimoles per liter, while the normal blood sugar was between 3L. Diagnosis: hypoglycemic coma encephalopathy. Xu Qiu prescribed a 50% glucose intravenous push and called the emergency department directly. The nurse came and handled it within 10 minutes. The old man woke up quickly and his hemiplegia symptoms gradually improved. After the outpatient clinic at noon, Xu Qiu felt tired for the first time in a long time. At this moment, he missed the energy potion a little. Dr. Su, are you back? Today, the neurosurgery department called to praise you, saying that you treated a patient with subdural hematoma in time. If you came later, the patient might be in danger. Yes, Dr. Su received more compliments in a week than I have in 5 or 6 years. Everyone was generous with their praise. At this time, the door of the office was knocked again. Li Shui, who had a cold face and a pretty figure, stood at the door with a banner in her arms. Dr. Su, she called. When Xu Qiu turned around, Li Shui was shocked. After not seeing each other for a few days, Dr. Su's charm has increased a lot, but she only looked at him for half a minute. After that, she adjusted her expression, walked in with long legs, and said while unfolding the banner, "Dr. Xu, a patient came to give you a banner." The medical publicity department accepted it. Seeing that it was a laparoscope, I thought it was from our obstetrics and gynecology department. "I'll send it back to you." Everyone in the office looked envious. "Damn, another banner. And it's a banner from a different department of disease, the gold content is too high." Xu Qiu took it and took a look. To Dr. Xu Qiu, that day, a hard object entered the body, that day, I was reborn. Signed, Luo Yitong. Xu Qiu said, and searched for this name in his mind. Li Shui knew that Xu Qiu had forgotten, and smiled and said, "Luo Yitong is the girl with ectopic pregnancy. You performed laparoscopic surgery on her at the beginning." Xu Qiu finally remembered it. There is nothing wrong with what the banner said. Laparoscopy is indeed hard, but the content is thought-provoking, but doctors are not surprised. Superb medical skills and rejuvenation are considered retro. Patients nowadays like to play with flowers. Among them, the banners of the anorectal department are the most famous. For example, "Less hemorrhoids, you have me." "Anus is good, you have me." "Excellent hands and kind heart, give me back my delicate little chrysanthemum," and so on. Xu Qiu's banner is nothing. Do you want to hang it up, or put it back in the drawer? I'll help you hang it up. After all, it's an honor. That without waiting for Xu Qiu to answer, Li Shui took the initiative to hang up the banner. After doing all this, she clapped her hands, put her hands on her waist, and was quite satisfied. Come to the obstetrics and gynecology department more often. Director Kong has been talking about you recently and said that she didn't have time to thank you solemnly. After leaving this sentence, Li Shui rushed back to the obstetrics and gynecology department. When he went to work in the afternoon, Xu Qiu still had a headache. There was no sign of daily tasks. He was struggling over whether to go to the urology department to get the root of the disease, or compete with interns and residents for the opportunity to suture. The urology department can't do 50 stitches a day. If we suture, there may not be so many people in the emergency department. Xu Qiu shook his head. Suturing is about quantity, and the patient can't wait for Xu Qiu with an open wound. He must hope that the stitches will be completed as soon as possible. Just when he was about to sew 10 gangsters, Bai Shi called. The female landlord Bai Shi yawned and said, "Hey, sister, is it time to remove the stitches?" Xu Qiu, remove the stitches after 5 days. That's about it. Today is the 4th or 5th day. I'm so itchy there, remove the stitches quickly. Xu Qiu estimated that it was about time and said, "Remove it. I'll come to you. Any clinic can remove the stitches." "No, I want you to remove the stitches. By the way, many sisters and aunts at GMA Plastic Surgery want to see you. Are you free?" Bai Shi laughed. Xu Qiu's plastic surgery suture, which is comparable to the restoration level, has made him famous in Jiada Medical and GMA Plastic Surgery Hospital. The women who were sutured by Xu Qiu had excellent healing effects and the scars were almost invisible. Bai Shi asked, "Are you busy this afternoon? If not, I'll tell Yan Yan and ask them to come to your hospital to help you increase your sales." Xu Qiu glanced at the task of suturing 50 patients and said calmly, "Okay." Half an hour later, luxury cars arrived at Linhai First Hospital one after another. The people who were about to see the doctor and the parking lot security guards were dumbfounded. Why did a large number of rich people suddenly come? Are they here to buy the hospital? In the newly repaired security booth, the security guard was stretching his neck, looking confused. Suddenly, a woman with gauze wrapped on her face and luxurious clothes threw something in. The security guard subconsciously caught it, and was dumbfounded when he saw it. Chapter 79. The cold women are only gentle to Xu Qiu. You are listening at novelfull.audio. It was a bunch of Porsche car keys. The 25-year-old young security guard, who was 30 years ahead of his peers, took it tremblingly and said woodenly, "Auntie." "No, baby, this. At this time, the woman had already walked away. The security guard was wondering. Suddenly, a group of women with delicate makeup and graceful temperament threw car keys in through the window and walked towards the hospital. At this time, he finally reacted and said, Hey. This is a public hospital, there is no parking service. For these ladies, the public tertiary hospital is a strange place, it is crowded, the staff is messy, and the attitudes of doctors and nurses are terrible. In high-end medical centers such as Jada Medical, they can drink tea and talk to the doctor about their condition slowly, but here, after a few words, the doctor will say next. TSK, if Dr. Xu Qiu wasn't here, I wouldn't have come. Yeah, the smell here is too bad, it's all disinfectant, it's really stinky. The system in Megwa is better. There's not even a parking attendant, it's so troublesome. After parking the car, the ladies complained and came to the emergency hall. They were not very familiar with it, so they found the nurse's desk and said directly, I want to see Xu Qiu. Lu Susu raised her head, took a look and said, what disease do you want to see? The lady pointed to the bandaged part of her face and said, face stitches. Lu Susu pointed to the side and said, go over there to register. The emergency department is very busy now. There is no designated doctor. Once you enter the treatment room, whoever is free will do it. Of course, this is just an excuse from the hospital. If someone really wants to do it, the patient has the right to refuse other doctors to intervene. The lady understood and went over there to queue up to register. Lu Susu was about to say what's the next person who needs help, but found that the people in front of her were empty all of a sudden. She stood up and looked, and then she found that the large group of women with outstanding temperaments behind her had left and lined up at the registration window. Lu Susu quickly called Xu Qiu. Xu Qiu's voice was still calm, and said, I know about this. Sister Susu, please let them go directly to the number 7 treatment room. I will be here in the afternoon. Okay. After hanging up the phone, Lu Susu's heart was still restless for a long time. What happened? So many beautiful young women came all of a sudden. Ah, it hurts. In the number 7 treatment room, she kept screaming when Xu Qiu removed the stitches. However, when she saw the egg-white face in the mirror, she felt that everything was worth it. Brother, sister loves you so much. She was happy from the bottom of her heart. On the side, Tu Yanyan hugged her arms and was a little surprised, but she still bumped Xi's back and said, be reserved and don't disturb Dr. Su at work. Okay, then we will stand by and watch you sew. Xi said. In fact, this was Tu Yanyan's idea. Xi was just an internet-addicted teenager who had no interest in boring things like suturing. Tu Yanyan was a doctor herself, and naturally admired the strong, especially the big guys in the medical field, but Tu Yanyan was very arrogant. Even if she wanted to stay and admire, she would not say a word. She also knew this, so she took the initiative to make this request. Xu Qiu didn't care and said, just don't bother me. Xi nodded with a smile, turned around and put on headphones to play games. Tu Yanyan stared at Xu Qiu's hand intently. Next. Chen Xiao said, soon, a long line formed outside the number 7 treatment room, and the people in the line were all women. All of them had a pampered temperament. The other treatment rooms were empty, and the doctors inside were stunned. I ran out to check and found that everyone was queuing in number 7. Hey, it's the same, come to our place to process faster. A doctor shouted. However, the beautiful young women in line just looked at him coldly and didn't bother to pay attention. Fuck, so arrogant. Any doctor who encounters this kind of patient will be unlucky. I guess he looks down on doctors from the bottom of his heart. Many people slandered in their hearts. At this moment, Chen Xiao walked out of the number 7 treatment room with her head down. She looked around and noticed Wang Fan in the number 4 treatment room, and hurried over. Hey, why did you come out? Isn't your teacher still busy? Wang Fan asked curiously. Chen Xiao was in a low mood. The teacher said I was too slow and asked me to ask Dr. Wang to help. Wang Fan stood up immediately, thinking to himself that he finally remembered that there was an assistant to the attending physician. Don't think too much, this is how we got here. Wang Fan comforted her and followed Chen Xiao into the clinic. Along the way, these beautiful women had cold faces and looked like strangers, but the moment Wang Fan entered the door of the number 7 treatment room, the scene seemed to be overturned. The originally indifferent woman was now looking at Xu Qiu with a smile on her face. Brother is only 24 years old. That's amazing. Let's have a meal when we have time. It's a great job. I'll go get my breasts augmented in a few days and come back to you for more stitches, okay? How much is your monthly salary? I'll hire you as my private doctor. Wang Fan was so surprised that he could stuff an egg into his mouth. He said in his heart, wow, I've learned a lot. This afternoon, the surgery ended with 37 cosmetic sutures and more than 20 ordinary patients. Xu Qiu also received the reward as he wished. Got it. Master-level Chen's longitudinal, U-shaped pancreaticogenostomy. This is a longitudinal U-shaped pancreaticogenostomy created by academician Chen of Daxia on the basis of in-depth theoretical and clinical research. Its efficacy and clinical application value are beyond doubt. A large number of clinical surgical analyses show that the average pancreaticogenostomy time of Chen's pancreaticogenostomy is 10 minutes, and the intraoperative bleeding volume is 280 milliliters. The overall incidence of postoperative complications Clavien-Dindo I4 is 40.41%, the overall incidence of key indicators of postoperative pancreatic fistula B and C is 6.04%, the data of the classic pancreaticogenostomy are 15 minutes, 320 milliliters, 58.72% and 9.54% respectively. Of course, there is an even more amazing advantage. Chapter 80, Sharp Intuition, Focused Patience. You are listening at novelfold.audio. Using Chen's pancreaticogenostomy, at the final stage of the operation, the pancreas will automatically be inserted into the intestinal cavity by simply pulling the suture, and this is the only way in the world that can do this. It is a cutting-edge suturing technique originally created by academicians of Daxia. Other anastomoses, often people need to push and pull. In surgery, less is more is important. To achieve the same effect, the fewer movements and steps, the stronger the surgeon's ability and the better the surgical prognosis. Chen's pancreaticogenostomy requires only a few stitches and the pancreas can fall into the cavity easily when the suture is pulled. Naturally, it can be regarded as the top surgical procedure in pancreaticogenostomy. I didn't expect that there are so many different things in there. Xu Qiu sighed with emotion after absorbing the knowledge in his mind. He also knew this anastomosis technique in his previous life. Moreover, it was done well, but after obtaining the master-level Chen's pancreaticogenostomy, he looked back and realized that in his previous life, he was rated as an expert at most in this technique. Still a long way from being a master. But Xu Qiu soon felt relieved. In his previous life, his energy was not focused on this. It was not easy to achieve an expert level in a technique that could be regarded as interlacing. Doctor, I've finished the infusion. Do I need another infusion tonight? At this time, a man wearing a hospital gown knocked on the door and entered the office, and Xu Qiu also came back to consciousness from the system. In the office, everyone took a look and said, he is a patient in charge of Qin Jia. Qin Jia pulled up the medical record from the computer and replied at the same time, no need for infusion tonight. The patient asked tentatively, can I go back and take a shower? Qin Jia glanced at the patient and said, pay at your own expense or be reimbursed by medical insurance. Hey, didn't you say that I don't meet the conditions for medical insurance reimbursement? At your own expense. The patient nodded grimly. Qin Jia stared at the computer and said intentionally or unintentionally, you have been admitted to the hospital now. In principle, you cannot go back. If you ask me, I will advise you to stay in the hospital, but we don't have time to keep an eye on you. The patient smiled, understood Qin Jia's hint, thanked him and left. Qin Jia shook her head helplessly and also smiled. She just looked at the patient's medical record, and there were no risk factors, and it was paid for at her own expense. If she didn't monitor and drink fluids at night, there wouldn't be much difference between being in the inpatient department and going home. Of course, as a doctor, she must have the obligation to strictly follow hospitalization procedures. As for the specific results, the legs grew on the patient. Many patients must personally say you can go back from the doctor. When treating such people, doctors often require that they must stay in the hospital and cannot go home. There is another group of people that doctors will strictly prohibit leaving the ward, and they are medical insurance patients, because people from the medical insurance bureau often come to the inpatient department in the middle of the night to order people. Once a medical insurance patient's bed is found to be unoccupied, the hospital will be severely punished and the patient's own reimbursement qualifications will also be cancelled. Besides, that if the risk of the disease is very low and the patient has a strong desire to go home, the doctor will slightly hint that as long as he is not hit and killed by a car on the road, it makes no difference whether the patient is hospitalized or not. After all, rules are also flexible. The next morning, when the morning shift was handed over, the doctor who took over the shift specially emphasized a few patients. There were 11 new admissions yesterday, and 4 were admitted last night. The first 3 are 15 beds, 21 beds and 26 beds. Their names are Yan Jing, Deng Dexiang, and Tong Lin. Yan Jing complained. The fourth patient is in bed 35, named Ma Pingchuan, 31 years old. Main complaint, back pain. Physical examination showed persistent and worsening pain in the middle of the upper abdomen, like a knife cutting. Nausea, vomiting, weight loss. The patient came to see the doctor at 3 o'clock last night. The diagnosis was 1. Acute pancreatitis, 2. Acute perforation of peptic ulcer, 3. Myocardial infarction. Xu Qiu sat quietly. The condition of the others is quite clear, but for the last one, because many examinations are not available in the emergency room at night, the diagnosis cannot be fully confirmed. At this time, Wang Ping called him by name and said, "Xu Qiu, go take a look at this Ma Pingchuan." The director's keen intuition made him feel that this patient needed special attention. Back pain is a dangerous sign. Angina pectoris, acute aortic dissection, myocardial infarction, ankylosing spondylitis, acute nephritis, etc. may all cause back pain. The first few are even more fatal diseases. Therefore, he looked around and finally felt that Xu Qiu was the most reassuring. Okay. Xu Qiu also agreed. There are no teaching rounds this morning. Wang Ping has to go to the clinic. Therefore, the attending physician and deputy director took on the task of ward rounds. Xu Qiu did not participate, but took Chen Xiao and a nurse to Ma Pingchuan's ward. The patient's face looked very bad, his lips were gray, and the trash can next to him was full of his vomit. There is also half a steamed bun and an unopened pack of pickles on the bedside. The patient's financial situation may not be very good. At this time, in the ward, Ma Pingchuan complained as he sat up, "Doctor, please let me go back. I just have gastroenteritis. Just give me some painkillers and stomach medicine. There is no need to do this or that test." Xu Qiu ignored him and said, "Check the individual first." Ma Pingchuan was a little angry when he saw that Xu Qiu ignored his words, but after Xu Qiu put on the gloves, his anger suddenly dissipated a lot, and he felt that this doctor was very responsible. It's not easy for the doctor, so let's cooperate with him. Ma Pingchuan compromised. On the side, Ma Pingchuan's wife was surprised. When did my husband, who usually has a bad temper, become so easy to talk to? On this side, Xu Qiu quickly completed the physical examination. What is more characteristic is that the skin on both sides of the patient's flanks and abdomen is dark in color and is faintly gray-blue. If Xu Qiu's judgment was correct, it should be gray tumor syndrome. The mechanism is, pancreatic enzymes, necrotic tissue, and bleeding penetrate into the abdominal wall along the peritoneal space and muscle layer, causing the skin on both sides of the ribs and abdomen to appear dark gray-blue. And these are the special signs of acute pancreatitis. In addition, the patient also had positive signs of pancreatitis such as decreased bowel sounds and shifting dullness. 9 times out of 10, it's acute pancreatitis. Xu Qiu took off his gloves and threw them into the medical trash can. At the same time, he said, "It's acute pancreatitis. We need to do another blood and urine amylase test to confirm the diagnosis." Considering the patient's financial situation, Xu Qiu only prescribed the most valuable examination. He put aside things like serum lipase measurement, amylase endogenous creatinine clearance ratio, blood sugar, biochemistry, etc. "Doctor, please don't do the examination. Can you help us save some money? Our community hospital just prescribed some painkillers and stomach medicine." Ma Pingchuan looked a little dissatisfied, but he said more. A little room for negotiation. Without waiting for Xu Qiu to explain, Chen Xiao explained, "Uncle, acute pancreatitis is no worse than a minor illness. If not treated in time, it will lead to multiple organ failure. Once it develops into severe acute pancreatitis, it will be very difficult to cure. And it will be life-threatening." Xu Qiu nodded. Chen Xiao's theoretical foundation was quite solid. Ma Pingchuan's eyes turned from Xu Qiu to Chen Xiao, and he immediately regained his temper and said aggressively, "Who are you calling uncle? I'm only 31, not 10 years older than you. Besides, your teacher is talking to me, why are you interrupting?" Chen Xiao was a little surprised. "What's going on?" "I was talking to the teacher so loudly and angrily just now, but then I turned around and started scolding myself." Here, Xu Qiu naturally knows the reason. The low-level affinity indeed makes the communication between doctors and patients much smoother. Since Chen Xiao couldn't explain it, Xu Qiu personally explained to Ma Pingchuan the dangers of acute pancreatitis. Looking at the patient on the hospital bed who seemed to understand something, Xu Qiu suddenly remembered something and felt a thump in her heart.